If this looks like you could be experiencing hip impingement symptoms from restricted adductors. Dr. Nicholas Mercer with You Improve PT. So when you have hip impingement, a lot of times with squatting movements or even when you're walking, you'll suddenly get this sharp pain in the front of your hip and it hurts really, really bad. It catches you off guard. It makes you like go and wince and grab that, and it's very frustrating because, you know, if you're going around about your everyday life completely pain-free, and then you go down, squat, try to pick something up, something simple, something really light, and you get a sharp pain, it's debilitating. It makes you think, oh no, this could happen at any time. Makes you more anxious, more careful with all your movements because you don't want to experience that pain again. Especially if you're walking with friends and you have to stop and hold your hip because it's hurting so bad and make everyone wait. It's just really, really annoying, frustrating, and aggravating. I've been there too. I've been the one who had to sit down because my hip was hurting way too bad. And, you know, it really interferes with your everyday life. Now, since everyone's situation is different, there's a lot of different muscular imbalances that can be going on that cause this hip impingement pain. Obviously, if you've read anything about hip impingement, you know, for most people, femoroacetabular impingement is thought to be a result of some extra bone or an abnormal femoral head up in your hip, or even part of your pelvis, the acetabulum, that gets a little bit of extra bone on there. And those are often associated with labral tears. So the purpose of this video is to address one potential factor in this hip impingement process, right? And that is the adductor muscles. A lot of us are sitting all day. We're not getting the proper activation and strength and range of motion out to the side, out into abduction, right? Out to the side like this. Think of someone doing a center split. That's abduction. And the reason we get this pain sometimes up through here is because the muscles on the inside of our legs, right, the adductors, the adductors, these are restricted because they're not used to lengthening. So when you go to do certain movements, they're pulling on that joint in a way that throws off the proper biomechanical movement of the joint. And a lot of times that causes the femoral head to pinch on the acetabulum right through here, right in the middle, because you have this extra pulling right up into your groin. So there's a simple stretch we can do to help lengthen those muscles and improve that movement into abduction. Don't worry, it doesn't involve doing a center split, although if that is something that you want to work up to, it's very possible to still do straddles and splits with hip impingement and labral tears. I'm not the only one, but anecdotally, I have no problem stretching my splits, going into a full straddle. But if your main goal is just to stop that pinching and pain when you're walking and doing squats, or going to lift something up, this exercise will help you just a little bit. It'll help you manage that pain, okay? So the first thing we have to do is get into a quadruped position, which is basically on your hands and your knees. And all you're going to do is the leg that you want to stretch is going to come out to the side. You're going to try to keep those toes pointed forward so that your knee is facing forward. You're just going to sit back, okay? Keep trying to get that leg a little further out, spread those legs apart. And so we're going to stretch one leg at a time so we have a little more control. And you should feel that in those muscles through here, right? You may start up here and be feeling a stretch here. That's fine, right? You're always starting where you're at. So just going to take nice deep breaths here, hold for about 30 seconds to a minute, and kind of do this throughout your day, right? Once that starts to loosen up, you can switch sides. And then when you're done, stand up, retest the squat, go on a walk, see if you get less pinching. And if you do, that might be one of the factors that is going into your hip impingement problem. So like I said at the beginning of the video, there are a lot of factors that go into hip impingement, femoral acetabular impingement, and labral tears. And while this may help you manage some of that pain a little bit, it's not a complete solution for your problem. And that is why I created the Hip Impingement Solution. It's a full program full of 15 tests over 1.5 hours of video content that is designed to first narrow down your deficits, your specific deficits, and then guide you to the specific exercises and techniques that are most likely to help you and your hips. No messing around, no looking through YouTube and Google trying to find an exercise that is the magic bullet for you that would just immediately fix your hips. I'm telling you right now, there's nothing like that. There's no one exercise that's going to just fix your hips. There are exercises that will help you manage the pain and decrease the symptoms a little bit, but no exercise by itself is going to fix your hips, right? However, that was the goal of this program, was to test out, do these tests, the self-tests, figure out those deficits, and then with the corresponding exercises and techniques, make a plan, make a routine was composed of several different exercises and techniques that you can follow to 1, eliminate your pain, 2, get your hips moving like hips should, and 3, ultimately manage your hip impingement, FAI, labral tears for the rest of your life so you don't have to go through surgery or eventually get a hip replacement, right? So that is the whole goal here, getting you to feel better, live an active and healthy life without going through surgery and without that hip impingement pain. So please, 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 if you are interested in getting one of these programs, go to youimprovept.com, shoot us an email, let us know you're interested. We would love to help you get back to that active, healthy life free from hip impingement pain. If you're not quite ready for that, that's okay. Go search around our YouTube channel. We have a playlist for hip impingement, which I will link above. And look at some of those videos, see if any of those help you. But again, none of them are going to be that magic bullet, okay? The closest thing that you'll get to a magic bullet is the hip impingement solution. So get in contact with us, go check out some other videos, and get ready to improve your pain, improve your movement, and improve your life.